vacancies and lack of personnel at health facilities in the Upper West region is contributing to the increasing number of people dying from cerebrospinal meningitis. Regional Director of Health, Dr. Seikufo Afre, who disclosed this, also added that the number of CSM infections is now at 258. He was speaking in an interview with Upper West correspondent Rafiq Salam, who has more in the following report.
40 people have died in the Upper West region. The number of CSM infections in the region has also jumped to 258. This comes at a time the country is battling the outbreak of another deadly virus, coronavirus, the organism causing COVID-19. Health authorities in the Upper West region say although the outbreak of meningitis in the region is an annual occurrence, this year has become difficult to deal with. Dr. Kufo Afre outlines some of the challenges health facilities across the region are facing.
Our region is saddled with low human resource, so we have fewer nurses, and also especially we have fewer doctors to also manage the cases. So some of our hospitals are just one-man hospitals, and the stress on them becomes too much because they need to assign meningitis, attend to other normal routine cases like malaria. They have to go to theater and operate. So you find out that the work becomes too much for one doctor in a hospital to manage. So we are stressed a lot because we don't have the required numbers of health workers to help in the fight. One of the preventive measures, which is very sure, is to immunize or vaccinate people against the disease. But unfortunately for us, the disease is not caused by one strain. So depending on some environmental factors and some mutations or whatever things that happens, this year you may get one subtype giving us meningitis. Another year you may get one subtype. So what we tend to do is that once the season starts and then we get to know which subtype you are dealing with, quickly we mobilize the vaccines and prevent those who are at risk.
Mother of recovered 5-year-old Amina speaks about her ordeal.
Right, she came from school and was complaining of her hip, that the hip was paining, but since they are children, so we thought maybe she might have fell at school during playtime and other stuff. So the following morning, the dad took her to regional hospital. When they went, they said maybe it was infections. They went and then they had to take x-ray and other stuff. So they gave us antibiotics. We came and then we were taking it. Still, there wasn't changes. There was no changes. So later on, we saw that she couldn't even sit on her own. She could not walk. There was a lot of stars. Like, she couldn't just sit. She was just stiff, straight like that. She can't sit. And then the mouth was even sore because she wasn't eating. There wasn't a lot of what she was not taking. There was the fruit all was finished. She wasn't. So later we saw that regional hospital didn't help us much. So we went to Dr. Matai's hospital. It's a private hospital. Exactly. Meza, yes. So that was where we went to. Then immediately we just got there. They started infusion water and other stuff. I saw that already she was getting better. The first water was gone and then she could sit small, but not very well.
The Ghana Health Service is expected to release a statement on this matter.
And that was Rafiq Salam's reports read to you.